So today I'll talk to you about our mission at Project Give Hope, the background, the purpose of the project. Tan will talk about the literature review, the settings, the barrier in advanced practice nursing, as well as the implementation of Project Give Hope, and then we'll come back with a summary. So Project Give Hope's mission is to bring awareness, prevention, and treatment of cervical cancer. When it comes to awareness, prevention, we provide seminars to third world countries where we teach women the importance of the HPV vaccine. We teach them the importance of getting the PAP exam, and we teach them the importance of safe sex. When it comes to the treatment of cervical cancer, we are advocates for two devices that we actually brought here today. One is called the thermocoagulator, the other is the EVA system. And we use that device when we do our trainings across the world. We use these two devices when we are conducting seminars with GYN specialists across the country to show that there's new technology that you can use to treat precancerous lesions on the cervix. So how did I get to create Project Give Hope? Well, first and foremost, my first visit to the wonderful country of Africa was in 2017. I went there as part of another humanitarian mission to take a medical team to Jinja, Uganda. And we were there for 10 days in which we conducted a mission to do some medical care to the men and women and children in Jinja. Unfortunately, it was not my project, and so I could not take the lead on the project. And as a result, I felt that the mission was not complete. I felt that we had failed the people of Uganda. And as a result, on that long flight home, I decided I was going to create something, i.e. Project Give Hope, to come back to Uganda and redeem myself and to complete the mission. And what I discovered while I was doing the research of Uganda is that Uganda has one of the highest incidents of HPV. I researched and found that cervical cancer is the leading cause of death in women in Uganda. 80% of the women who present with cervical cancer are already in the final stages or in the higher stages of cervical cancer, and a lot of them die because of it. Only 4.8% of the women actually get PAP exams. So it's important that we at Project Give Hope really teach early detection and prevention when it comes to cervical cancer. And that's because we are very passionate about women's health. So let's talk about the background for Project Give Hope. Cervical cancer is the fourth most common and lethal cancer in women worldwide, accounting for nearly 300,000 deaths annually. In certain populations and geographic of the United States, incidence and death rates are still high due to limited access of cervical cancer screening. About 80% of all cervical cancer diagnoses are in women younger than 65. Cervical cancer disparately affects developing nations. Around 85% of all cervical cancer and 87% of cervical cancer deaths occur among women who are living in developing nations. In many developing nations, it is the most common cause of cancer in women. So you see the importance of us really advocating for PAP exams, really advocating for the HPV virus, and implementing new technology to treat precancerous lesions on the cervix using the thermocoagulator and the EVA system. So what is our purpose? Our purpose is to save the lives of women in 20 seconds. So you're probably asking, why 20 seconds? Well, it only takes the thermocoagulator 20 seconds in order to treat a precancerous lesions, compared to cryotherapy, which we all know takes about 11 minutes. So it just makes sense to incorporate this type of technology into third world countries where we can treat more women, we can treat it quicker. This device is actually handheld portable, FDA approved. This device does not require the gas cylinders that cryotherapy uses, and it has less painful effects, most women say, when they are treated with the thermocoagulator. Our goal is to take a team, as we have done before, of doctors, nurses, medical technicians, to countries where we provide the training on the two devices in our master training curriculum that we've created. Our goal is to actually raise funds to purchase the thermocoagulators in the EVA systems, which are very expensive, and we're to give that to these countries that invite us to come in. Last but not least, we actually do the screen and treat method when we do our seminars and we do our medical clinics, in which we're able to screen women using with the PAP exam, and we treat them with the thermocoagulator so that no woman gets left behind or leave the clinic without getting treated. At this time, I'll turn it over to Ms. Ellen.